Yes, good morning, everyone. I am going to go to the presentation mode and I'm going to minimize this one so we can see the deck better. So I'm here to talk about Aboutcome. The name of the company suggests that we really care about the outcome of the treatment that people are seeking to improve their mental health. And we here, my partner and I, we're here to try to solve major societal problems that we see every day in my work as a therapist. I am a therapist myself. I see that every day when I speak with the clients. We know that more than 1 in 5 adults have a mental health illness in the US and of course in the world as well, but we're focusing now on the US. And we know that mental health cost the US economy billions of dollars every year. And we know from studies that if clients engage in therapy, they will see more than half of those clients will see clinical improvements, significant improvement in their mental health if they stay with the therapist for at least 8 sessions. But we also know that unfortunately, many people leave treatments prematurely. They leave treatments after their first sessions. And we are really talking about up to 75% of those people who really need help, who want it, but who somehow drop out prematurely. So our quest is to understand what it is that makes people drop out before they get the help they need. And so I've done some studies, I've interviewed people, and I've found that there are 3 reasons for why people terminate prematurely. One of them is really the relationship between the client and the therapist. If they feel that they don't have a good relationship with the therapist, they can't trust, they feel judged, or they don't feel empathized with the therapist, they will leave treatment prematurely. We also know that some clients have told us that I don't think that's a good fit between me and the therapist. Culturally, I don't think I'm understood by the therapist, and also the approach. I would like to explore deeper feelings and they tell me what to do. So there's that lack of fit as well that we've heard people mention. The third one pertains to more environmental factors, like they don't have the time to go and see a therapist. The cost can also be sometimes difficult for people, and also location-wise. So those are the main predictors of premature dropouts. So what we want to do with Aboutcome is that we're going to help clients or patients, I use these terms interchangeably. We want to help patients achieve desirable, measurable treatment outcomes by matching them with the right therapist and also helping them access critical patient information so that they can make informed decisions for themselves and for the family. Right, so we match, we provide them information about how they're doing, because sometimes we don't know how we're doing. We see a therapist, we feel better or sometimes worse after a session. What does that mean? And then if we do those things, we believe that patients will get what they are looking for. So what are we going to do exactly? So during phase 1, I'm talking more about the phase 1, is we're going to use a unique algorithm for matching to ensure that there is a therapeutic alliance between the 2 parties. We're also going to give patient access to critical information about the progress, treatment plan, things like that. And then we're going to make sure they can schedule an appointment right away so they know that hope is on the way, they don't have to wait too long. Business model, we are targeting like a paid membership. So therapists are going to pay for this model. So they can opt for a standard model, where meaning that we're going to provide them with referrals and also give them a telemental health platform. They can do telemental health so that people can save time and money as well. If they upgrade to the premium model, they might access a network of other therapists that can get training and supervision. That's going to help them grow professionally, but also increase their confidence. And also in doing so, decrease premature dropout of clients because they become a better clinician. Elite membership is when they get help with billing and legal services and more. In terms of how we're going to start out is we're going to seek early adopters. We're going to target psychology students who have a problem like everybody else, and they're aware of the problems that they have, and they're very eager to find a solution to their mental health. And those people would be more than eager to refer friends and family. If they know there's good therapists out there, this is a good platform, they would refer, and people around them would usually trust their recommendations. So that's what we're aiming for. One of the last slides I'm going to show you is really about the competition landscape that we have observed, right? So if you look at the degree of matching, I'm going to go back to this slide, sorry about that. In terms of matching, we will definitely be more advanced in that area because we're going to develop that algorithm that we're going to test out. And then also in terms of empowering patients to know more about their mental health and make important decisions, we're going to give them access to those information. So we are also ranked high on the patient empowerment matrix. And so you look at other therapists, they will be less focusing on matching and less focusing on giving patient information. It's more like a directory kind of model. They match on insurance, gender, and race, but not going to the depth that we're looking for to do. And that is more or less what I have for today. I want to keep it short, and I'm more than willing to answer any questions you have. I'm going to stop sharing my screen.